Welcome to today's briefing on how Medi-Cal is expanding maternal health care. I'm Sandy Close, Director of Ethnic Media Services. EMS and California Black Media are partnering with the Department of Healthcare Services, DHCS, to present the fourth in a series of 6 briefings about how Medi-Cal is transforming healthcare services in this state. As you know, some 15 million Californians are enrolled in Medi-Cal today, including 1.3 million children. Doula services, and that's spelled D-O-U-L-A, doula services are a key focus of today's briefing. Doulas are trained professionals who provide physical, emotional, and informational support to patients before, during, and after childbirth. In the past, their services were not covered under Medi-Cal. Today, they are. Experts view doulas as essential to closing racial and ethnic disparities in outcomes, particularly for Black, American Indian, Latino, Asian American, and Pacific Island parents and infants. They help improve birth outcomes and reduce C-sections, epidurals, premature deliveries, low birth weight, anxiety, and labor length. Other ways that Medi-Cal's transformation is helping families and babies lead healthier lives through and well beyond conception include a birthing care pathway for members from conception through 12 months postpartum, dual care programs for both parent and child called dyadic care, and new benefits for pregnant members, including some who exceed the Medi-Cal income limit. I'm now turning the briefing over to EMS's Research Director, Selene Ozturk, who will introduce our speakers and moderate today's briefing. Selene, over to you.
Wonderful. Thanks, Sandy. At this briefing, a DHCS leader and 2 doula community healthcare providers will share how Medi-Cal maternal health programs are helping families and babies live healthier lives through and well beyond conception in the ways that Sandy talked about. Our speakers include Erica Holmes, who is the chief of the benefits division at DHCS, Kairos Chiaji, who's a Medi-Cal doula provider and founder of Children of the Sun Doula Project, and Kefri Riley, another Medi-Cal doula provider who's the co-founder and director of Frontline Doulas. We ask reporters to enter questions in the chat, and our speakers are also encouraged to answer questions in the chat throughout the conference. We're going to send a video of today's briefing along with expanded bios for each speaker later today, and we'll send video excerpts of the presentations early next week. And now we welcome Erica Holmes, again, chief of the DHCS Benefits Division, who's going to give an overview of these newly expanded maternal health services like doula care, along with who's benefiting and how, and what's next for doulas under Medi-Cal. Erica, please go ahead.
Thank you so much. Good morning, everyone. On behalf of the department, I want to thank you all for the opportunity to speak with you today to highlight some of the transformative and innovative work that is happening in the maternal care space. As you are likely aware, Medi-Cal covers approximately half of all of the births in the state of California. To this end, the department has made significant efforts to reduce maternal illness and death in California and to address racial and ethnic disparities in maternal health outcomes among Black, American Indian, Alaska Native, and Pacific Islander individuals. The department has done and will continue to do significant work to improve maternal care policy and programs for birthing individuals that address physical health, mental health, and health-related social needs in both traditional and non-traditional care settings. Medi-Cal's approach to providing high-quality maternal health services and supports has changed drastically in the last few years, with Medi-Cal taking a completely different approach to care delivery and offering more options for birthing individuals than ever before. Currently, all Medi-Cal members are eligible to receive coordinated care from the start of their pregnancy through 12 months postpartum, which will help birthing individuals and their children navigate things like prenatal checkups during pregnancy, birth plans, and mental health treatment like postpartum depression. After all, one of the best things a birthing individual can do to keep their baby healthy is seek care early and often. Additionally, the department is working diligently on the Birthing Care Pathway initiative. This new healthcare approach supports Medi-Cal members from conception through 12 months postpartum, regardless of birth outcome. The Birthing Care Pathway initiative is envisioned as a care model with related benefit and payment strategies in the Medi-Cal program. It will encompass physical health, mental health, and health-related social needs, translate clinical care and care management guidelines into care processes and workflows across different healthcare settings, and facilitate adoption of those guidelines. Further, the department wants to ensure that every single birthing individual is informed and can take control of their health journey. Members have access to many options when it comes to choosing maternal care providers who are sensitive to cultural and language needs, as well as individual preferences in terms of the time, place, and manner of the birthing experience. With these larger approaches in mind, I do want to take some time today to discuss some of the specifics around the new benefits and services that are transforming the maternal healthcare landscape and support a diversity of choice for birthing individuals, whether it is through traditional or alternative care providers. For example, in addition to the traditional maternal benefits that Medi-Cal has already offered, such as prenatal checkups, ultrasounds, and hospital stays, Medi-Cal now covers care provided by doulas and midwives. Doula services are a covered benefit of the Medi-Cal program as of January 1, 2023. As was stated, doulas provide person-centered, culturally competent care that supports the racial, ethnic, linguistic, and cultural diversity needs of Medi-Cal members using evidence-based early intervention and clinical best care practices. Doula services are aimed at preventing birth complications and improving health outcomes for both the birthing individual, their babies, and their families. Doula services include personal support to birthing individuals and their families throughout pregnancy and 1 year postpartum under Medi-Cal. This includes emotional and physical support, as well as support for and after miscarriage or abortion. Services include guidance, health navigation, evidence-based education for prenatal, postpartum, childbirth, and newborn and infant care, lactation support, development of a birth plan, and if appropriate, connecting birthing individuals to other community-based resources. To increase access to services and reduce barriers, the department has issued a standing recommendation for doula services. This means that Medi-Cal members don't have to get a separate written referral to receive Medi-Cal covered doula services. Instead, members can go directly to a doula who accepts Medi-Cal to begin receiving care. To help members find doula services, the department has created a doula directory where you can find doulas who accept Medi-Cal by county. You will find other information, including doula specialties, language spoken, ethnicity, and their contact information. The department will be updating this directory on a regular basis. As of the end of May of 2024, the department's pleased to announce that we have approved 455 group and individual doula applications, 336 of those being approved individual doulas. The department is also pleased to highlight that Medi-Cal reimbursement for doula services is among the highest in the nation. Doulas get reimbursed at the same rate as other service care providers. Overall, the department is very encouraged by the level of engagement it has seen, and 2 of our doula partners will share their perspective on accessing this very important benefit later in today's briefing. In addition to doula services, certified nurse midwife and licensed midwife services can also be provided to birthing individuals and their infants, including clinical services. This means that in addition to traditional maternal care providers and doulas, there are even more options for birthing individuals to choose from. In March of 2024, after an extensive stakeholder process, the department updated our policy to ensure that both certified nurse midwives and licensed midwives can bill for and provide all clinically appropriate services within their scope of practice. The department is also in the process of creating a dedicated midwifery webpage, similar to the one for doulas, that will offer important information and serve as another avenue for promoting greater awareness about the availability of these important services. Lastly, I want to highlight that Medi-Cal also launched a community health worker benefit. This benefit can also be helpful in providing culturally responsive maternal care support that goes beyond the traditional framework of care. The department added this benefit as of July 1, 2022. Community health workers are trusted members of their community who have lived experiences that align with and provide a connection to the communities in which they operate. You may know them as promotores, community health representatives, navigators, or other licensed public health workers, but they can also include other specialties such as violence prevention. CHW services include 4 main categories: health education, health navigation, screening and assessment, and individual support and advocacy. These community health workers may provide many different services under each of these 4 larger buckets, including particularly to help support individuals through their pregnancy journeys. In closing, the department has made strides and will continue to take additional important steps to strengthen maternal health coverage and care for birthing individuals by implementing various programmatic and policy changes, including implementing the Birthing Care Pathway Initiative to improve health outcomes and reduce disparities, expanding options for birthing individuals in terms of available maternal care providers, including traditional providers such as OBGYNs, but also alternative providers such as doulas, licensed midwives, and certified nurse midwives, and extending coverage for Medi-Cal eligibility from 60 days postpartum to 12 months postpartum and eliminating premiums for families. The department is committed to continuing efforts to reduce maternal morbidity and mortality and address significant racial and ethnic disparities in maternal health outcomes. Thank you again for the opportunity to speak with you today to provide these important updates on our maternal care work.
Thank you, Erica. And it looks like Griselda Mendoza put in the chat a doula directory. I'm wondering what the process was like bringing doulas, particularly to more rural and isolated communities in California.
Sure, it's a great question. Yeah, it's a great question, and I would welcome my doula colleagues also to weigh in on this question. But it's a challenge whenever you create a new benefit and enroll a new provider type. So there's a lot of outreach and education that has to occur in order to ensure that not only members are aware of the benefit, but that also providers, in this case doulas, are aware of the process for enrolling into our program, which admittedly can be complicated. And so we've partnered with our doula providers on this call and through other stakeholder efforts to help provide technical assistance and guides to enrolling in our program to make sure that we have doula representation in, on a statewide basis throughout our various counties. And then most recently, we also created a checklist, which I believe will be published very soon if it's not already up, that helps doulas guide through the process of mandatory things for enrollment in terms of what they need to become a provider within our program. So, and again, would welcome feedback from my doula partners as well.
Wonderful. And how unique is California in providing doula services? Are they available through Medicaid in other states, or do you see them following our lead in this in the future?
Sure. So on the national scale, doula services are quickly picking up momentum. There's quite a few other state Medicaid programs who are covering doula services as part of their sort of suite of services that are available to members. We are part of a collaborative of other state Medicaid programs and participate on sharing best practices and reducing barriers to accessing these services. And so, yes, we are seeing a lot of sort of movement in that direction of ensuring that members have access to a suite of options when it comes to their own birthing experience.
Wonderful. I also have a question in the chat asking if you could direct us to data about disparities in childbirth outcomes across races and ethnicities that DHCS has been bridging. or if you have them on hand. Another question is, even when I was writing a story about doulas, getting into Medi-Cal just a year ago, there was it took years to get them accepted as professional health providers. I'm wondering what the process was from the advocacy perspective, how to get them integrated into broader medical services.
So on your first question relative to data, I just want to acknowledge we will drop a link in the chat, but CMS just did a really good analysis from a nationwide perspective on health disparities in the maternal care space that I think would be really helpful for this group to take a look at. And then on the state side, we will take that back to see what data we might have available and share that in a follow-up email with this group. On the integration piece, and again, I have experts on the call with me today from the doula perspective. So I'll just speak from the state perspective. There's a paradigm shift that needs to occur when you're bringing in these new provider types to a program that is traditionally a medical type program. And so I think there's a lot of education and outreach that has to go not just to members, but also the broader provider community to help them understand the important role of doulas, how they integrate as part of the healthcare delivery team for a birthing individual. And this is challenging. So this is an area where we have seen significant challenges in terms of integration, for example, in hospitals or other settings where you have doctors or nurses who have been traditionally delivering babies in those settings. And so having the doula integrated as part of that care team is obviously extremely important. And so we are working in close partnership with the doulas on today's call, as well as others, to help bridge some of those gaps and reduce barriers to ensure that the doula is a valued and trusted member of the care delivery team for the birthing individual in all of those various settings.
Wonderful. Thank you. And please stay on for general questions at the end if possible. And we now welcome our second speaker, Kairos Chaji, a doula for over 25 years who founded Children of the Sun Doula Project, provided an early health plan funded doula service pilot program through DHCS in Northern California, and now works as a doula through Medi-Cal in Sacramento. She'll be talking about her work advocating for the doula community while bridging maternal health access gaps through Medi-Cal, about how you've been able to, as you put it earlier, bring community-based relationships into a medically managed system. Ms. Chiaggi, please go ahead.
Well, I am incredibly excited to be here, to see the faces that I have seen prior to now, and also to get a chance to just speak and say hello to our media brothers and sisters who really carry the burden of getting this information out to the people who actually will benefit from it. As Celine said, I have been a doula for 25 years. So I've seen lots of iterations of how this work happens. And I will say that although there are other states who cover doula benefit through Medicaid, California has really taken it to a level of practical usefulness, being willing to learn what doulas do so that they can assign a value to it and then share that and make it a part of the standard of care. A lot of people don't know what birth workers, what doulas do. And so I would liken it to like a personal trainer, but for childbirth. So our job is to get to know you, get to know what your goals are for your body, for your baby, and help you come up with a plan, and then help you remember that plan. In addition to people wanting to be healthy, they join a gym, right? They go to some place that has all the equipment, all the materials for meeting their health goals. In the same way, doulas go with their birthing clients to whatever environment has the tools for meeting their birth goals. It might be hospital, it might be birth center, it might be home birth. We do have the privilege of being able to enter whatever birthing space that our clients' insurances or resources allow and provide for them. And so in that sense, we can be very, very flexible. But also as people of color and as community members, we also have shared experience with our clients. We have been those birthing people in the various environments. We have encountered the same language or culture barriers. We have had the same unanswered questions and really could understand the benefit of having someone who can not only explain it, but really be a bridge between the community member and the birthing environment, and particularly in hospital settings. There are lots of acronyms and things that are thrown around, and policies and procedures that are par for the course for medical providers that are all very new and scary and unknown for birthing people. So we are able to help our clients develop a labor plan, which is one of those things people forget that is needed. Like, what do you do in between labor starting and the baby being born? We help our clients develop a list of preferences for how they have their baby, how the baby is born. And then we are there to support the client and their families and their friends for that early care when baby comes home, and then that little bit later care when everyone else goes back to work and there is a parent with a shiny new baby and really needing lots of support there. Because while the term postpartum is defined as the first 42 days after birth, those of us who have children know that that is only the beginning, and that, you know, what happens if the breastfeeding challenges happen on day 43, or what happens if mom starts to slide into a depression that no one would recognize because she's very good at covering. What happens when there are additional children in the household that needs to be integrated, and a person who just had a baby would love a chance to have a shower and brush their teeth and not have to choose between the two, because there's a tiny little person that just needs all of their help and support. On the more serious side, we know that our country and our state are in a maternal health crisis. There are injuries and losses that statistics say are 80% of which are preventable. And so as a birth worker, as a doula, we are able to fill in a lot of those gaps. We are able to amplify the voices of families. We are able to recognize when something is happening that's not okay, recognize it earlier on, rather than it being a state of crisis and someone's running to the ER. We're able to help our clients navigate healthcare. What happens if you don't have insurance? How do you get that presumptive eligibility Medi-Cal? How do you make a phone call to a doctor? What happens if your doctor is not available to you and you still need care? So we have that experience, we have that knowledge, that know-how. And like myself and Kefri here, having done this for decades, literally for decades, we're able to not only educate our families, but train other birth workers to be out and do this work. And my belief is that with enough of us having this training, this understanding, this education, every community can be its own best solution for this birth outcome crisis. So at the end of my career, and as Kefri knows, I plan to retire when I'm 209. I would love to see there be so many folks that have been exposed to this, that it is really not a new thing. It is just the norm. And that when somebody says, hey, I stubbed my toe and I don't know what to do, that someone in their circle will say, well, call your doula because she'll know. And everyone will know what that is.
That's wonderful. Could you talk a bit about what populations you serve right now, how many clients you tend to have at a time?
That number varies widely. I literally serve anybody who needs. The only qualification for me supporting you through pregnancy and birth is that you are pregnant and going to give birth. That is the qualifier. My priority, as is understandable, would be Black and Indigenous people with our poorest birth outcomes, landing there 3 times as often, 3 times as high, the risk for a mother who happens to have more melanin, because as much as we have all of the advancements in science and technology and medicine, we have not quite gotten that far with removing bias from systemic spaces where birth happens. So my priority is always to make sure that the mama with melanin is going to be okay. And if she's not okay, that somebody knows and that somebody does something about it.
That's beautiful. And what has Medi-Cal allowed you to do? You know, what was the process of working with DHCS to build up this network of doula workers and what they can offer?
Well, that is two different questions. And
It's true. Yeah.
the first thing that it does, that being able to be a Medicaid provider does, is allow me to eat. For so many years, in order to do the work, we had to focus on the outcome and not the income. And our state has said, no, that's not okay, that people do work for long hours, and the studies and statistics will show how many hours doulas, particularly doulas of color, invest in our families and in their families and the extended families. So it has allowed us to do it in a way that is respectful, that doesn't require our dignity, that doesn't require our own detriment. We don't have to sacrifice lifestyle necessarily for being able to do good work. The other part of what you asked was, what was it like to work with our state to develop that benefit? And I tell you, it's almost like it's not real. Like, this thing doesn't happen. And I've been doing this for 25 years, and it has only been in the last 2 plus going to 3 years that we felt like we had the ear of the decision makers, that we felt like we had the attention of the decision makers. And I would say, honestly, in the last year, we have known for sure we've had the heart of the decision makers to be able to push this forward, to understand that the need outweighs tradition. Right? If the tradition is people only receive care in this little box, and we understand that that box doesn't have enough room for all of the lifestyles and lives that we'd like to see flourish, that we need to step outside of it. And DHCS has done just that. And even the fact that we are included in those conversations, that they listen, that they come back, that they ask more questions, it gave us an opportunity to put flesh on bones, right? Numbers are just sort of lines. And when we are able to share the stories and experiences of our clients, but also the experiences we've had in our own bodies, it changes the paradigm, right? It shifts the idea that pregnancy and birth are a pathology that need to be cured, and that people need to dot I's and cross T's in order to have access to healthcare that makes sense to them. And so we were able to move our state into a position of understanding that a large part of healthcare is leveraging relationship. And the group that has the ability to found and maintain those relationships are birth workers and health workers and peer support specialists. A lot of us birth workers out here wear all of those hats. We switch them around, because we know that pregnancy and birth is not just the body producing a 7.5-pound baby. There are a whole lot of things that need to happen prior to then. For some families, the birth connects us, but there are a whole lot of fires to put out before we get there. So it has been wonderful. If you had asked me 10 years ago if this would have been a thing, I'm not sure I would have believed it. So I'm grateful to be in this space and happy to keep moving and pushing.
Yeah, here, the way you put it, medically supporting healthy birthing is a function of community relationships rather than a pathology to be cured is just how I satisfy my own curiosity. Where do doulas come from? What's the origin of the word?
So the origin of the word is different answer than where the practice comes from. Indigenous people have always had birthing aunties and mamas and specialists. We've always had midwives. We've always addressed that time period in someone's life, and the solution was community. Who's going to feed you? Who's going to make sure that your home is taken care of, your laundry is done, your other kids are good, right? And so it is an ancient practice. Like we think of it in this Western kind of world as a non-traditional thing, but it is actually the original way of supporting birth. The word doula is Greek, not necessarily with a positive origin. It means woman who serves, if we say it nicely. It can mean slave, but as our Western philosophies tend to do, we take the word that is closest to what we want and we assign a value to it and we run with it. So that's why you hear me interchanging the term doulas and birth workers, birth supporters, birth coaches, because we do serve our community and we serve them well, but we're not slaves. And thanks to our great state, we don't have to work for free as if we were.
You're really giving living dimension right now to how serving can be empowering. How did you yourself get into doula work from the very beginning?
Well, I would have said it was an accident. I did not know at the time in my life the things that were guiding me towards birth work. But I happened to be working for one of the original organizations here in California and in the country that was combating maternal mortality and morbidity in the Black community and infant mortality and morbidity. It was the Birthing Project. And my job was administrative. I was chasing monthly reports and sending out training manuals. That was my job. And I came into the office one morning and the founder, Catherine Hall Trujillo, said, there's a woman who's in labor and she's probably by herself and you need to go find her and you need to go be with her. And I did not live in Sacramento, but she was the person who signed my paychecks. So I got in my car, I went to the hospital, I found this mama, I introduced myself because she didn't know I was coming. She didn't know me from Adam. I said, hey, Mama Cat said, I need to be here. And so we bonded very quickly. I tried to remember everything I had ever learned in a childbirth education class, having my own babies, and we had a little boy. And at the end of that birth, when she and I are hugging and crying and just excited about this miracle that we've witnessed, because that's what I do, I get to witness miracles for a living, the nurse there said, you need to go get certified. And I had the most amazing reaction to that. I said, for what? And so she gave me information on a training and I went and I sat in that training and I said, oh, this is it. This is my life's work. And from that point, I could look back and see that the pregnancy experiences I had in various OB care models, from military to community hospitals and clinics, that the time that I spent in retail management of a maternity clothes store where there was this community of pregnant and birthing bodies. And I did that work on the West Coast. I did that work on the East Coast. And both times I had babies in my own belly, right? And so that building of community. And then I attended the birth of my oldest niece, little Kairos, and a provider came into that room and medicated my sister-in-law without saying a word. And that woke up the advocate in me. And I knew from that moment on, never again, not on my shift. Like there will be respect, there will be what we call informed consent. All of those things started happening. And then I got sent to that birth and then I got trained and I have not quit.
Thank you so much for sharing that. Please stay on. I'm sure many would love to hear more about it as we open up questions toward the end. Thank you again, Ms. Chiagi. We're now going to hear from Kefri Riley, who's the co-founder and director of Frontline Doulas, serving over 700 families, particularly African-American families, through community doula programs all throughout LA County. She's also been working with DHCS, like Ms. Chiagi, over the last 2 years to build this brand new doula benefit and workforce. Kefri, we'd love to hear your own story entering the doula space and working now through Medi-Cal with communities where, as you said in an earlier talk, the largest risk lives with the least resources. Please go on.
Oh, thank you so much. It's such an honor to be here with my esteemed colleagues and members of the press. I've served as a doula, educator, advocate, and business owner for over 23 years in the field of birth work and maternal infant advocacy, and now as co-founder and director of the Frontline Doulas program, where we've served hundreds and hundreds of African-American families with culturally congruent doula care. We create innovative, culturally competent, solution-oriented programs to address the maternal infant mortality crisis. These must be community-centered initiatives to fulfill the need for conscious healthcare connections and advocacy that facilitates empowered communications with healthcare providers, communities, and consumers around birth justice and human rights at birth. We are rooted in human rights. We want to uplift the voices of the communities and the families that we serve, and we want to replicate and honor the healthy, joyful, sacred aspect of birthing that is everybody's right to have. And I birthed my son on Medi-Cal over 23 years ago, and it's truly an honor to be a part of this significant health benefit for all families who deserve equitable and quality care in 2024 and beyond, because it's time to reclaim birth and really change the narratives into something that is impactful, that is healthy and whole. I know each and every one of you on this call can discuss a birth experience in your family or family lineage that you wish had gone differently, that you wish were treated differently, that you wish you were heard and listened to, that your sister or mother or auntie had an experience that you wish were different. And doulas are here to become a part of the team, the collaborative care team, to contribute to positive outcomes. Myself and my incredible co-design team members, the community members and activists helped to collaboratively design this benefit with DHCS. So we acted as direct liaisons, providing community doula expertise, culturally sensitive advocacy, policy writing, development for CASB 65 legislative implementation, advice and advocacy for equitable Medi-Cal doula benefits for all people, all birthing families in California, but in particularly for Black and Indigenous birthing people and people of the global majority to achieve equity in the birth and reproductive space. This absolutely is a historical benefit. We have the highest reimbursement on all doula benefits in the United States. It's rooted in reproductive justice and grounded firmly in the hard work and vision of those activists, advocates, and visionaries who have indeed birthed this into life. So this has taken years of collaboration with DHCS and community activists, advocates, policymakers to create something that is very different than other states. And one of the ways is that this is really focused on community care, community doulas. And community doulas are typically from the communities that they serve, and they connect clients to community resources more so than traditional doulas, and have centered the experiences and voices of the community. So they're more likely to encounter families with social economic hardships, and these things impact perinatal stress and health, and then we see adverse outcomes. And given that community-based doulas are focused on marginalized or underserved birthing families, they're more likely to witness and support clients in navigating institutionalized racism and cultural incompetence within the medical setting. And we're not going to silence that aspect here. It's very exciting that this is a new benefit. And those of us on the call here have been working hard to train the new workforce, to break down the steps that are required to become an approved Medi-Cal doula provider, and to reduce the barriers to become the provider. So this is why we need your support in getting this message out that doula care is now covered under Medi-Cal for Medi-Cal beneficiaries in California, and what a doula is or a birth worker does, or what these services can do to create positive outcomes so that you do not have to feel afraid or alone, and your voice does not have to be silenced, but uplifted and centered. So since community doulas typically provide services to underserved or historically marginalized communities, our particular focus has been there with our communities. And having given birth on Medi-Cal 23 years ago, none of this was available then. Now, when you think about doulas or birth workers, they really are coming from a historical lineage from the Black grandmother midwives or Indigenous midwives or midwifery in general. So this is not some new thing. This is actually rooted in traditional care of families. It is a community practice. It is healing work. It is radical. It is natural. It's a cultural inheritance. Each and every one of you here, looking back over 50,000 years of humanity's lineage, somewhere along the line, there was a doula, a partera, a birth worker was present. You were not alone. Your ancestors were not alone in giving birth. And so this really has huge cultural significance, especially to underserved communities, to Black and Indigenous communities, that they can choose the care provider that aligns with them, aligns with their beliefs and cultures, their language, their ethnicity, just who they wish to be there. And if you look at the evidence for doula care, it's really just the presence alone of a support person, and that support person is there for the birthing person. And this benefit covers all aspects of the reproductive journey, including abortion or pregnancy release, miscarriage, stillbirth, etc., and the first year postpartum. This is very important to share with the community. That year after a pregnancy is complete, a doula can come and support you. Most likely that support will be in the home. It can be via telehealth, it can be however the family needs it. But this can radically transform our outcomes because a lot of the maternal issues and demises happen in the postpartum period.
Could
So,
you talk a bit about the community you serve and particularly their needs regarding the postpartum period?
well, I think that it's really important to know that our doulas serve all. It's very important. This benefit does not discriminate. It is for everyone.
Yeah.
And it's very important that we know that. Our community doula program specifically focus on Black and Indigenous families and communities because that's where the highest disparities lie. And so if we can focus on bringing down, it does not make any sense that a Black birthing person have to worry that they are 3 to 5 times more at risk of dying in childbirth in 2024. And so while this has not been what doulas have created, institutionalized racism and structural racism has created this problem. And many of these deaths are preventable. And one of the preventable interventions that can help this is doulas. And so by having a doula by your side during your pregnancy, and then during your birthing time, and then in the postpartum period, significantly lowers any of the adverse outcomes and increases positive outcomes. So that means lower cesarean births, lower uses of interventions that may lead to other poor outcomes, increased birth satisfaction, increased breast or chest or body feeding. And if we have increased breast or chest feeding in the postpartum period, we have a decrease in infant mortality. And so all populations are served here, all ethnicities, all languages. And we have a focus on Black birthing families because that's where the highest disparities lie.
Thank you. I'd like to open one question to both you and Kairos, and then open questions to you, Kairos and Erica. Can either of you as doulas give a specific story that comes to mind of either helping carry a birth through and or the experience after that through the first year of the baby's life?
I absolutely can. One dynamic that I find particularly thrilling is that so often when we support someone through a birth, after they've had this experience, they go on to training to do this for someone else. And so that happens a lot. My oldest babies are college graduates now. 25 years ago, those kiddos are 25. I'm still Mama Kairos. And so the family, the extended family, the community connections continue. There are times when it is having the person who knows you and knows birth and knows hospital and medical systems saying, you got this. We're looking at all of the things that they taught us, and you've got this. Your baby and your body are communicating that you are okay. And that can be enough to get someone through without maybe a surgery being involved, just being able to have the birth that they envisioned, that they managed. Often what we find is that feeding the babies after, right, when they get home and you your baby is 1 day old when you get home, and you have to run around to do postpartum appointments with pediatrician on day 2 and day 3 and day 4. And so you haven't had an opportunity to rest. You haven't had an opportunity to nourish and replenish your body from a very big job. And we struggle with feeding babies. We struggle with even understanding what's supposed to happen with that. It is a natural thing, but it has only 2 gears, and that is really, really easy or really, really hard. And so to be able to step in that gap, and when, when it's afternoon and there's a hard time, then you can call someone and they come and they sit with you, or you go see your doctor. But when it's 3 a.m. and you are just broken and you're crying and the baby's crying and you have no idea what to do, to be able to call your doula, who will come and sit with you through that night, get that baby fed, get you some rest, get that baby some rest, and connect you to an IBCLC from your community, somebody who looks like you, who's been where you are, who is an expert on that feeding, to come and be with you. And not hand you to a stranger, and not hand you another piece of paper with an 800 number on it to who knows who's on the other side, and you're not even entirely certain what it is you're supposed to ask for, right? To have that is that makes a difference in the post-birth experience, because we really focus on those babies coming out. Yes, how much did the baby weigh? He's alive and he's 7.5 pounds, right? But that's such a very small part of the story. And so preventing depression, or addressing it if it starts to creep in, or any of those things. And so for me, I knew it was winning when a young man, 18 years old, in the hospital with a girlfriend, with a baby that they could have predicted based on their activities, but they were surprised. And the care that they were getting just wasn't, they didn't feel safe. And he called me and he's like, Mama Kairos, can you come? Can you come? Can you help us? And so I went, and immediately there was a shift in the setting. The providers on their shift changed. The questions that they were being asked changed. And in fact, the fact that they were being asked questions,
Wow.
it changed, because sometimes you go into a setting and people tell you what's going to happen with your body. And while most of us reject that in any other space, we wouldn't let the grocery store clerk tell us what we're going to buy. Somehow we get into a medical setting and it becomes a different thing. Someone can tell us what they're going to do with our bodies. And so just being able to be there for that young couple, keeping Dad sane and stable because he was so afraid, and his role in his little tiny family was protector, right? But how do you protect someone when you don't know what it is that's supposed to happen or not happen? And so to be able to be there with those two, I have a picture right now of him holding his baby girl. She was a whole 8 pounds. I said, you have a whole daughter. And he goes, oh, I have a daughter, right? And it was just that's a great beginning versus some other trauma, right? Like literally your first ACE should not be the day you were born. So let's keep it going, right? So now they know, now he knows, all his friends will know when he's playing basketball or, going to work or doing whatever that is, he is a person who can say, oh, bruh, you should have a doula, call my auntie, right? And I only became his auntie because I was at his daughter's birth.
Wow. Thank you for sharing that. And Kefri, do you have a story of a birth that particularly comes to mind?
Well, there's a few, especially in our programs where we've served so many families. In particular, one of the mothers comes to mind who was a younger mother. She was in transitional housing. She was birthing alone. One of our doulas, Felicia Francis Edwards, was able to be assigned to her as a doula. What's important about this client is how she found her agency, how she found her voice, how the threat of them potentially taking her baby away and to not be in her care was always present. So this looming threat was there, knowing that she was in transitional housing, and helping connect her to resources. The doula was able to do so, and our program was able to do so, to connect her to resources and to connect her with her birthing advocate, her doula, who centered her voice during her birthing experience, who helped her avoid a cesarean because she really wanted to move. She didn't want to be on her back anymore. She wanted to be able to be in her body and try different positions. And so the doula uplifted her choices to the healthcare team, and now they're collaborating. Not only that, but when things started becoming more challenging and more difficult, this client was able to directly advocate for herself, even with her family. So now, because the doula has, I guess, reflected back to her what her desires are and that she is valuable. And so after we've given birth, we are in such a vulnerable time. We also need to be taken care of. So doula not only helps to support the caretaking of the birthing person who's just given birth and their infant, but also helping them create a postpartum plan so that way family members step in to help. And she really needed her family members to step in to help her so that she could make sure she recovered properly and was able to get any services aligned that she needed so that her baby could stay with her and that she could recover and go on to have a really healthy postpartum, right? And so doulas actually act as advocates specifically for more marginalized folks, specifically when those voices need to be centered and heard, or when we see that they are actually being silenced, because oftentimes voices are silenced. Whether or not we like to think of this, we don't want to think that it's such a negative birthing world out there, but
Right.
because of the nature of the facts are that this is happening, the disparities exist, and there's a lot of help that institutions need right now in integrating new family care practices. And so right now, us as advocates who are at the table, advocating for all California families to have equitable care and for the voices to be centered and for their care teams to be specified so that they get the compassionate care that they deserve. In another instance, unfortunately, one of our families, our doulas were giving care to April Valentine. April Valentine passed at Centinela Hospital, and the father of the baby, Nija, was very specific because, and in sharing how important doula care was to him in the postpartum period, but also when the hospital declined the doula into the hospital, which was previously approved at the time of the birth, when April asked for her doula to be there, they did not allow the doula in. They did not allow the doula to support this family. And Nija, the father of the child, reported back that he felt that if a doula had been there, maybe something different would have happened.
Yeah.
Maybe they would have listened. Maybe they would have acted quickly. Maybe this demise wouldn't have occurred. And so while we cannot put the backs of this crisis on doulas or birth workers, what we can do is understand the importance of community-centered care and centering the voices of birthing individuals and the powerful evidence-based impact that doulas have by their very presence alone. And so while we mourn April, we celebrate the birth of her beautiful daughter and the care that the father Nija is doing and the advocacy work that her family is doing. But we cannot afford to have one more demise when it's unnecessary. And so it's important for people here on this call to know that while doulas are not medical professionals, we are allied healthcare professionals, we are perinatal support professionals, but we are cultural care that is a part of the human gift of giving birth. And we should not give birth alone or feel unsupported. We should not have a pregnancy release and feel unsupported. We should not have a miscarriage or stillbirth and not feel unsupported. That social emotional support is proven to have better outcomes. And that's why this benefit is so historical.
Thank you. We're getting a little tight on time. We have a reporter in the chat, Celia Rodriguez, asking to be connected to a Spanish-speaking doula to get the word out to their media, if someone with DHCS can do that. I also have a question related to what Kefri was saying for Erica. We have focused on doulas, but Medi-Cal is also trying to address postpartum depression, dyadic services, meaning treating both the parent and the child, just whole health stressors for moms. Erica, could you talk about some of these other services real quick?
Sure. So obviously when we're thinking about Medi-Cal, we are really focused on providing options for the birthing individual in terms of how they want to receive their care and how they want to sort of have their birthing experience play out. And so I know you mentioned dyadic services, which I didn't touch on necessarily in my initial remarks. So I do just want to add that dyadic services are a new sort of model of care delivery that we have also recently launched in our program, where we serve the Medi-Cal child as well as their parent or caretaker in a dyad, so together at a healthcare visit to receive services and supports. And so both the parent can receive independent services as well as the child in that setting, which has been shown to also improve health outcomes and address disparities. So we're just thinking at the department holistically about how we deliver care and looking for innovative approaches and strategies to address necessary services and supports on the continuum from, initial point of pregnancy all the way through the postpartum period to help improve maternal health outcomes. So,
Thank you. And if I did want to find a doula that was, spoke a form of Chinese or Spanish or served Native American communities, how would we be able to find that?
So I can start, and then I would welcome Kefri as well to weigh in. But essentially on the doula director, we provide information on language spoken. I do want to flag that the doula directory is voluntary, so doulas provide information to us that they want us to include on the directory. So not all of the information may be included for every doula. But that is one way that you could find that information. And then we have excellent advocacy partners on today's call. And so I'm sure that if you reached out to either of their organizations or them individually, you could get connected. So I will defer to them on how you might suggest individuals get connected.
Thank you. Yeah, and if someone could connect our reporter in the chat looking to be connected, that would be great. And if each of our speakers could provide a brief closing statement, if you could, almost impossible to do with the richness of everything you said, but encapsulate something you want the media to know in a headline, so far as maternal health and doulas Medi-Cal goes, please. Kairos.
I would love to just lift up the opportunity for all organizations that are out providing care to our communities, that we can absolutely train Spanish speaking and other language speaking doulas to do this birth work, so you don't have to leave home to have your needs met. So I know that Kefri's organization does trainings, my organization does trainings, there are many. And California has been careful to make sure that culturally humble and culturally congruent organizations are at the forefront of being able to prepare doulas to do birth work and operate through the DHCS benefit. In closing, I really just want to say thank you to everyone who took the time to be here, who's observing this and absorbing this. I'll tell you, once you've seen it, you can't unsee it. And so as you move through your days and weeks to come, you're going to see opportunities where you say, oh, that person should have had a doula, or that person needs a doula. And now you know what that looks like and what that means. And you don't have to have all the answers. But you do have that provider list. You do have the contact with myself and Kefri, and it is just, it is, I will say, literally a dream come true to be able to do this work in a way that doesn't wash the community out of us and benefits everyone. Everyone has a right to this. Everyone who chooses should have access, and that's the thing that we're trying to make happen.
Thank you. Kefri?
Yes, I just want to say that doulas are here as part of an ecosystem that is committed to changing adverse outcomes to positive outcomes, to lower interventions, to lower cesareans, to increase birth satisfaction, which leads to a healthier reproductive cycle for all birthing people, and in turn, the communities within which our children are raised. This benefit will affect the children in the future and our communities and the health of all communities. And so we thank you for supporting and uplifting and taking this message into your communities so that we can in turn give the highest level of service to Medi-Cal beneficiaries.
Thank you. Erica?
Sure. So I think one of the takeaways would be that Medi-Cal members have choices in terms of how they want to, go through their birthing experience and have those practitioners or providers who are there to support them through their journey. And so I think it's very important that our media partners help convey that message. Doulas are an absolute integral part of the care delivery team. And so to the extent someone wants a doula, they should be able to access a doula. And so we want to lift that up through, you all to help spread the word. And certainly if you have any questions or you need any assistance, we are always here to be supportive at the department. So thank you.
Thank you. The theme that really stuck out to me through all three of that was how you can't focus on outcome to the exclusion of income. Investing in doulas means investing in the families they serve, and California is at the national front lines of that, thanks to DHCS. You guys said yourselves historically this simply did not happen, yet now you have the ear of the decision makers. I want to thank DHCS and each of our speakers for letting us see what this means to witness miracles for a living on the ground, and helping our media share with our audiences how groundbreaking it is for a public health system supporting birthing as a function of community relationships rather than a pathology to be cured, as one of our speakers said. Thank you so much. This conference is now adjourned.